present for you, dear assistants, lecture about contribution of acupuncture before surgery, because acupuncture is an ancestral therapeutic approach from Chinese medical tradition. It's validated by numerous research projects that meet current methodological requirements. Acupuncture involves the stimulation of specific points on the body, often using the needles or direct pressure with the aim of preventing or treating certain symptoms such as pain and nausea. At the time when there is development of a non-drug therapeutic supported by the global reflection because of their effectiveness in major area of public health and their excellent benefits risk ratio, Chinese medicine benefit from this craze. Among the many fields in which Chinese medicine is reputed to be effective and widely used, the treatment of pain through acupuncture represents an important theme of daily practice in our profession, like anesthesiologists. Hi, how are you, my friend? Yeah, you're welcome. So acupuncture can reduce the severity of pain, which reduce medication dose. To date, acupuncture has been used effectively to manage preoperative pain and nausea in several surgical specialties in adults, children, areas of analgesic efficacy established with supporting meta-analysis include neurosurgery, orthopedic, obstetric and gynecology, thoracic oncology, oral surgery and general surgery. This analysis supports the concept that peripheral use of acupuncture is safe, well tolerated, and effectively reduces pain score, analgesic requirement, and postoperative nausea, vomiting in adults and children. The therapeutic art of acupuncture in traditional Chinese medicine is based on an energetic vision of the man connected to the universe in accordance with the so-called Taoist thought, and is absolutely opposite to mechanistic vision of the human body transmitted to us by the age of enlightenment. Its history is 1,000 years. Manuscripts dating back of 5,000 years referred to it, and it remained widely practiced all towards the Asian continent. You need to know that the first acupuncturist is Paul Jean Soulier de Moran, a French diplomat, who was the first acupuncturist to do acupuncture and to bring this kind of acupuncture to Europe. But the problem is there was a rejection of this therapeutic art by the community, scientific community, medical community, and until 1957, there was a doctor from Lyon named Paul Nogy, who was the first to represent the projection of all body on the earth, and he did publish the publications of the book which was published all around the world, and he was presented to Mao Zedong, who recognized the discovery system in widespread in China and has led to intensive research by Chinese medical authority at a time of renewed interest in traditional Chinese medicine, after learning Noji Air Charles in 1958, a major study was initiated by the Nanjing Army Air Research Team in acupuncture. This Chinese medicine group verified the clinical effectiveness of Noji's approach and the evaluation of airplane-specific disease, which matched total clinical record and more than 2,000 patients. The result of this research was very positive and led to use of this therapy by the barefoot doctors of the Cultural Revolution. China was published a graph here remarkably similar to that of Dr. Noji in 1958. In the United States of America, introduction of acupuncture in 1920 and the expansion from the 1971 following the article written by a journalist named John Rexton, who was the journalist working in the New York Times relating to acupuncture care of his appendicectomy while following the President Nixon on travel to China for the U.S. Army, representing a reliable alternative and without risk of side effect. And since 2008, the doctors in the Army were trained to use battlefield acupuncture before getting to the hospital. Medical care since 2003, the World